Hello, everyone. Welcome to the third episode of Unplugged with Ross. I am your host, Roslyn Miner, and today I am joined by consultant urologist Dr. Kagiri. Dr. Kagiri is a consultant urologist at the KNH Othaya Annex. He is also the secretary of the Kenya Association of Urologists. He's a member of the International Society of Urologists, and tonight he will be joining us as we have a discussion on prostate health. Today's session is a men's special edition, and we will be gaining more insights on prostate health and how to go about it to ensure that we have a healthy lifestyle. Our brothers, our spouses, our fathers, any male figure that we have in our lives is fully aware of, their prostate health and how to go about it. Before I hand over to Daktari, I would like to share some statistics on prostate health. So prostate cancer is the second most common cancer in men worldwide. Over 1.4 million cases, new cases were reported, prostate cancer cases were reported in 2020. In Africa, prostate cancer is the most diagnosed cancer amongst men. African men face a higher risk of aggressive prostate cancer. Early detection actually provides for 98% plus survival rate, and regular screening is key, especially for men above the age of 50 and also those that have predisposition to prostate cancer within their family. Last but not least, did you know that lung cancer is actually the most common and deadliest cancer in men? So today we will be talking about prostate health. And as I hand over to Daktari, karibu sana. And I am looking forward to this conversation. I know it's
Thank you,
one
Roslyn.
conversation that people normally are afraid to have, especially men, and when it comes to prostate health.
That is very
So
true.
yeah, so to start off, it would be good to understand why should we have a conversation on prostate health, prostate cancer, and everything in between. Why should men pay attention to their prostate health? The myths, we need to debunk the myths when it comes to prostate. And also, what are those early signs? What should someone know as a start? So, Daktari, karibu sana. Over to you.
Thank you so much, Roslyn, even for the invite. It's a very good discussion to have. It's not common to have it. You'd be surprised how many men even know where the prostate is. Even some women even know where the prostate is, yet they don't even have one. So some
Yeah.
of those things we discuss, where do you find it? What is it? What's its function? And beyond that, of course, the disorders that affect the prostate. And, it's an organ, yes, but remember, even when we're treating the prostate, we're not treating the prostate, we're treating a human being who is carrying the prostate. So I think to begin, I'd like also to sort of demystify which doctor would a man go to if they needed a prostate health check. I know you mentioned in the introduction of a consultant urologist, but what is a urologist? Surprisingly, many people don't know. So, a urologist is somebody who's trained. They're both male and female urologists, by the way. So, they are trained to take care of the urinary system of both the male and the female, but also beyond that, they take care of the genitalia of the man. By genitalia, and I'll describe the anatomy. I have
Yeah.
something I'll bring into short, into frame, just
Yeah.
to better explain what I'm talking about internal, external genitalia. So that's what a urologist does. Takes care of the urinary system of both the male and the female, and the reproductive system, internal and external genitalia of men. So
Right.
why prostate? Prostate, and I'm glad you came up with this topic. It's a very important one for men, especially when they're aging. And of course, for every man, they have an elderly man in their family or
Yeah.
a middle-aged man in their family, both even men and women. They have people who are advancing in age and they have issues with the prostate over time.
Yeah.
So the two common conditions that affect the prostate, and I think before I even get to the conditions, I'd want to maybe bring into frame something I usually used to use in discussions and just to explain the urinary system and how to understand it better yet for a male. This information is not only important for men, even for women,
Yeah.
because surprisingly, women also somehow push men to go and have their health checks. The wives will push their men, their sisters will push their fathers, or their daughters will push their fathers to go and
Yeah.
have a checkup. So, this is, so to say, the anatomy of a male. If you look at it,
Yeah.
it's it's like the anatomy of a male into half, and you get to see what's on the inside part,
Okay.
or what is considered to be the external and internal genitalia. So
All
I'll
right.
start from what is obvious. From outside the body on the frame, this, of course, is the external genitalia of the male, that's the penis. And right below it or behind it, here at this point, I hope you're able to see the pointer well on your
Maybe you
side.
can lift it slightly.
I can lift it slightly.
Yeah.
Okay, let me do that. Is that
Brilliant.
better? That's
Yes.
better. Good. So we have talked about this. What you can obviously see from the outside, that's the penis. And you get to this point here, which can obviously from outside, this is a scrotal sac that contains the testis. And we'll talk about the function of what that is in the reproductive health of a male. Now, what we
Okay.
can't see is from here going inside. So all these organs you're seeing here
Yeah.
is what you can see on the inside of, and this is a representation of the adult male. Similar structures you'll find in the younger males, but this is actually a representation of an adult male. I hope you're still
Okay.
able to get me.
Yes.
Good. So I'll start from above here, going all the way down and explaining what you see. Okay.
Okay.
And from here going up, I may not necessarily explain it because I'll just deal with the lower urinary tract system. And what I mean by the lower urinary tract system, it starts from this point. So what is this? That looks like a circle, almost like a muscular bag or balloon. This is the urinary bladder. So when urine is formed all the way from the top, from your kidneys, it flows down through a pipe called the ureter that ends up opening into this pocket,
Yeah.
and it fills up over time. And at a point, you feel like going to the loo, you go and empty it, and the bag collapses. So it's not usually open like this, it's collapsed. And it
Okay.
fills in with urine just the same way a balloon would fill in with air.
Yeah.
Same principle. So it fills in. Once the man is full and is feeling like to urinate, then something happens. All the way, if you look at this point, yes, look at this. You see that thing that is looking like a strip going all the way down
Yep.
there?
Mm-hmm.
That is a urethra. So the
Yes.
urethra is a channel or a canal that urine flows through from the bladder to
Mm-hmm.
all the way to the outside. So
Yeah.
that's the urethra. It's a conduit. So for males, you'll find the urethra is much longer just because of the external genitalia, but for females, it's shorter because this part of the external genitalia is not there. So once urine is stored, it's released and goes through that channel. Call it pink. You can hear me? Are you able to hear me?
Yes, you're back. Sorry, the screen had frozen for a short while.
Okay. Yeah.
Yeah.
So I was trying to describe this circular looking like organ
Yeah.
right below that bladder.
Bladder.
And I was trying to give it a color. On my side, it looks pinkish. I don't know what you'd call that color. So
Yeah.
that is where the prostate is in the adult male. Okay.
Okay. All right.
Even in the young male, but it's more pronounced in the adult male just because of it's increasing in size. So that
Okay.
is where it is. And over time, what happens if you look at that conduit, like I was trying to describe,
Yeah.
this conduit, if you assume my fist is the prostate and this
Yeah.
point I'm using is the urethra,
Yeah.
it goes through the urethra like that.
Okay.
The urethra goes through the prostate like that. So
Yeah.
this is not usually open like that. It is all round. The urethra is inside the prostate.
Okay.
And it's important to understand that because of how the symptoms will come on later.
Okay.
So that is exactly where the prostate is for a man to know, or for the ladies to know where we usually
Yeah.
find the prostate.
Okay.
Now, I'll come to the part of examination of the prostate and now the conditions that affect the prostate. But at least for now, I hope the anatomy is a bit clearer of where the bladder is, where that urethra is, and where
Yeah.
the prostate is, because it's
Absolutely.
important in the symptoms we'll be discussing.
Okay.
Okay.
Very, very clear, and it's quite interesting the connection that it has from the bladder to the
Mm-hmm.
prostate,
Mm-hmm.
and in consideration that when you experience someone that is complaining of, oh, my father or my grandfather is having
Mm-hmm.
trouble having a
Passing
pee.
urine.
Yeah,
Yeah, true.
passing
Mm-hmm.
urine. Now that is now
Mm-hmm.
starting to make sense.
Mm-hmm.
Yeah. So now, in
Mm-hmm.
consideration now that we understand where the bladder is and where the
Mm-hmm.
prostate is,
Mm-hmm.
then the question then even becomes more important as to why we should embrace prostate
Mm-hmm.
health. So take us
Mm-hmm.
through,
Yeah.
the importance of understanding prostate health.
Okay. Okay. So the prostate itself, like I mentioned, it's an organ. It's in the male, it's not in females. It has a function, and that function doubles up with something that I didn't mention because it's not clearly visible on the anatomy I was using. Seminal vesicles. They connect at some point to the prostate, and their
Yeah.
main function is when sperms are produced in the testis, they end up getting something called seminal fluid. And part of that, the secretions of the prostate, the seminal fluid, what is its function? To keep the sperms alive and in an environment that is not too harsh for them before fertilization happens. So that's
Okay.
mainly the function of the prostate. Now, why the prostate? Because over time, the prostate can be affected by two conditions. One, we call it benign uh, prostate enlargement, and the other we call prostate cancer. Now, both of them can involve enlargement, but not necessarily for prostate cancer. You can still have it without the enlargement, but the enlargement is not cancerous because cancerous cells are described as cells that can migrate from that point to another point in the body, and obviously resulting in the harm that would cause, depending on what cancer it may be. So, for benign prostate enlargement or non-cancerous prostate enlargement, you don't have the cells migrating, but it just enlarges in that anatomical position. So, for the cancer, now you have aggressive cells or cancerous cells that can equally enlarge but can also migrate elsewhere. So let me start with a benign condition because all these diseases affect the prostate and we need to relate them to how you'd identify there's a problem. Now, I usually like going back to something called an International Prostate Symptom Score.
Okay.
What is in abbreviation, it's called IPSS. So an International Prostate Symptom Score has a series of questions that a man who thinks they may be having an issue with the prostate can actually go through and score themselves. It's usually self-explanatory. It's something even a medical provider, all the way from the clinician to the nurse, would be able to explain to a non-medical person who'd want to use that scoring system to know, are these symptoms related to the prostate or are they not related to the prostate? So that International Prostate Symptom Score has a series of 7, 8 questions. So they talk about frequency. So frequency just means it's an English word. How frequently are you urinating? Are you doing it every minute, which is not normal? Are you doing it every hour, which is also not normal? Are you doing it how many times are you going? Are you always, you're not able to sit in a meeting, you're not able to sit in a class, you're not even able to sit at home and just be comfortable in your seat without feeling the need to go to the loo. And
Okay.
you're able to score that and say, okay, I go less than 5 times, more than 5 times, and that at the end it will give you a score. So issues with the prostate can cause that. But remember, also other issues with the urinary system can cause that. And that's why we usually encourage men to seek that health advice because you may not be able to diagnose yourself at home. You could be having frequent urination, but be probably just related to an infection. A UTI can give you the same thing. For those who take alcohol, maybe you've taken too many beers, you're producing a lot of urine, or even for taking lots of water, you probably go to the loo more frequently than somebody who take an average amount of water or just a normal daily intake of water.
Yeah.
So by mentioning these symptoms, yes, they're related to the prostate, but they are not diagnostic of only prostate issues. So remember, even as I mentioned the symptoms, other urinary conditions can cause that. So that one is the first one. The second one, we call it incomplete emptying. English word again, you feel like the bladder has not completely emptied. You've gone to the loo, you've peed, but when you go back out, you feel like, I still feel like there's some urine retained. There is something that has not yet come out. So you'd still give a score to that. The other one is how many times do you wake up at night to go and urinate? We usually call it nocturia, going to the loo at night, specifically urinate, not opening your bowels. I'm talking about urinating. So
Yeah.
if you're waking up once, that's normal. If you're waking up twice, that's still within normal. If you're waking up 4, 5, 6, 10 times, then there could be an issue related either to your prostate or also to your prostate and the blood and the urinary system. So that's something also good to watch out for.
Okay.
Another symptom we usually see is weak stream. By weak stream, meaning that you're passing the urine, yes, but it comes out very slowly, almost the same way you'd open a tap of water until it's just removing a small stream. The flow
Yeah.
is not as it was probably when you are in the younger ages, in the teens, as a boy. And
Yeah.
there's a game, uh, people, boys, African boys are very cheeky.
Mm-hmm.
Put the urine, the stream keeps on getting weaker up to the point where the man will go to the loo and the urine is dropping right at the feet, which is not normal. So checking that weak
Okay.
stream. Now beyond that, you'll see somebody having something called urgency. Urgency is where it's urgent. When you feel like going to the loo, it has to be now. If you don't go now, you end up urinating on yourself. Now it goes above, it becomes urge incontinence, where you're not even able to hold that urine. If you don't get to the loo fast enough, you're not able to hold that urine, urinate on yourself. So urgency is another indicator that could be an issue with the prostate, and not only the prostate. A collection of these symptoms together, and of course, as we are assessing, as we're taking a history from the patient, these are some of the symptoms that would be top of the list.
Okay.
And you'd see other symptoms is you could have dribbling, which is an extension of having a weak stream, where now it's
Okay.
not just a weak stream, it's drops coming out, and they're not able to have a fully consistent stream. Now, among other questions that are not in the International Prostate Syndrome Score,
Yeah.
you'd have people who have a double voiding, or they are unable to initiate that urination. It's almost like a delayed urination. You want to go, but there is hesitation. We call it hesitancy, where before you could get to the loo and immediately you want to go to the loo, the urine comes out. But here there's a bit of hesitation, and the urine doesn't come out. It takes a few seconds to come out, then it comes out. So a collection of these symptoms, we give them a certain score, and you could have that score as being either mild or moderate or severe. Now remember, the symptoms that we're talking about are not just specific to, let's say, enlargement of the prostate or prostate cancer. You could have the same symptoms if you're having prostate cancer, and it could be silent even with prostate cancer. But for the benign growth, the non-cancerous growth, when those symptoms appear and we assess the prostate, and I'll come to how we assess the prostate, then it is likely that the origin of those symptoms is the prostate. So up to that point, I hope it's clear enough.
Yes, very, very enlightening. I think one of the questions I would have for you is what
Mm,
causes the enlargement of the prostate?
mm,
So prior to, reviewing what the IPSS,
mm,
the various criteria that is there,
mm, mm.
what would cause an enlarged prostate?
Enlarged
What are
prostate.
those, yeah, what
Mm,
are those scenarios? How does it come
mm,
about? How
mm,
can,
mm,
is it avoidable?
mm,
Is,
mm.
yeah.
Very good question, Rosalind. That one, I'd say there are genetic factors to it, but one of the biggest ones is age. The
Okay.
more time or years a man lives, the more likely for his prostate to enlarge. As much as there are genetic factors to how big that prostate will be,
Yeah.
time, age will cause the prostate to grow. Now, the prostate feeds on something else. And this is the male hormone. We call it testosterone. Testosterone, you remember where I showed you where the testes were in the
In the
image that
script.
the
This,
anatomy that I was showing? So that is
yes.
where testosterone is produced.
Okay.
Yeah, much of the testosterone produced in the male body is produced there. It circulates through the whole body, and one of the organs it will affect and cause to become bigger is the prostate. So over
Okay.
time, still exposure to that prostate and the genetics of it, then that will cause prostate enlargement over time. Now, it does not mean that if your prostate is enlarged, then there's a problem. You could have a prostate, the normal size, we equate it to about 30 grams.
Okay.
But you could have a 50-gram prostate that is not cancerous, but does not give you any symptom. So the size of the prostate doesn't mean it needs to be treated. If it is symptomatic,
Okay.
such that we can relate it to show that it's causing some effects on the urinary system, if it's causing blockage, or if it's related to prostate cancer, then that's when we treat. So take home message that it means if the prostate, take for example, you go and have a scan done and you're told the prostate is big, it doesn't necessarily mean there's a problem. If there is no cancer and if it is not symptomatic, it does not have to be treated. But if there
Okay.
is cancer and it is symptomatic and the symptoms that I was talking about, then we need to do something. That's when we decide to treat.
All right. Now, at the risk of sounding,
Mm.
unintelligible,
No, no, no.
unintelligent.
Please ask it.
Um,
Mm.
so, so the testosterone is produced in the testes, and the testes are
Yes,
mainly in the scrotum or the
yes,
scrotal sacs.
yes.
How does this testosterone, travel
Mm,
back up? Because it's the
mm,
scrotal bags, or the scrotum is
mm,
on the exterior. You can
mm,
actually see the exterior part of it.
mm,
But how does it travel around the body? Because I would assume, just like
mm,
in women, where we have
mm,
progesterone and the likes in terms of
mm,
hormones that
mm,
manage or maintain the body, I would assume that
mm.
testosterone does the same.
Yes, it
So
does.
how does that
Mm.
work for the male? How does that
Okay,
work out?
okay. So testosterone is part of a hormonal system within the male body.
Yeah.
So part of the testis being an organ, it means that it's also supplied by blood vessels. Blood vessels meaning arteries and veins.
Yeah.
Now, arteries, and it's like that with every single organ in the human body. So, arteries will bring blood to the testis. The testis will produce the hormones. Veins will have the hormones and take it to the whole body.
Yeah.
When it gets to the prostate, and every part of the body will react to the testosterone depending on the receptors that it has, and that's why you see men having beards, some their hair cells, and you'll see when there are things we call secondary sexual characteristic. You'll see pubic hair coming, the deepening of the voice. Those kind of things are as a result of testosterone. The same
Okay.
way the prostate will react to the testosterone. So the prostate produces and the testis produces testosterone. It flows the veins taken back to the heart and pumped around the whole body. So that's how testosterone gets to the prostate.
Okay.
That is how
Makes
it gets to the prostate. Yes.
All right. Thanks for that. So,
Yeah.
in a sense,
Mm.
the hormonal system, is part and parcel with this whole, every single
Oh,
element
yes.
of the
Oh,
body.
definitely, definitely. And you'll see. Mhm.
So, now that we understand how, the enlargement happens, the older you
Mm,
are, the higher, probability of that happening. There's the
mhm,
genetic predisposition, and then there is the testosterone. Now,
mm,
when it comes to the testosterone,
mm,
as a factor, is it because it's too much or it's too little? How I can understand, age
mm,
by default,
mm, mm,
genetic predisposition, maybe if your father, or there's that
mm,
genetic predisposition, that
mm,
is easy to understand. But now
mm,
when it comes to testosterone, is it because it's too
mm,
much, or is it too little, or how does that impact the enlargement on failure, I mean, or lack of it when it comes to the
mm,
prostate size?
mm. It's not a factor of how much it is because most of these hormones within the body are within a certain range, and you'll
Okay.
find the low range and the high range. Anyone in between that range, then it's normal.
Okay.
So the testosterone, in fact, even you see even daily cycle of a man, the testosterone is not the same level at a different time of the day. It
Hmm.
differs,
Yeah.
and we see testosterone being highest during the early hours of the morning, anywhere
Okay.
between 5, 6, 7, all the way up to 9 o'clock in the morning. Then it sort of tapers down. It tapers down during the day. So testosterone has that cycle,
Okay.
and for you see it even relating to when we are talking about erectile dysfunction. There's a question we ask men when if they have early morning erections. So that's also related to the testosterone. It's related to the hormonal system because when it is testosterone is at its peak, then often we'll see those early morning erections. So when
Yeah.
it relates to the prostate, it's not about the level, how high, how low, not necessarily. The prostate itself has receptors. These are things that will bind with the hormone and whatever mechanism will happen within the prostate cells
Yeah.
that relate to the function of that hormone and or how that hormone will affect the prostate cells, that is what causes the enlargement. And beyond that, there
Okay.
is genetics to how many receptors, where they are, what function they are doing. So not necessarily the level, because the level is within a certain range, but
Okay.
the action of the hormone itself on on the prostate.
Makes absolute
Mm,
sense. If I
mm,
can recall science
mm,
for back in the day in primary school, and
mm,
when teachers were teaching about, when a boy is getting into teenage life,
mm,
so they can get wet dreams, the breaking of the
mm,
voice, etc.
mm, mm,
So again, when now you look at an adult, you can look
mm,
at, yes, the morning erections or even their sexual
mm,
activity,
mm,
dependent on where or how their day is. Obviously
mm,
there will be a peak
mm,
or a dip of it.
mm,
So if we can now go to aspects to do with myths,
mm,
or misconceptions that are there to do with
mm,
prostate health, what are
mm,
some of the things you have encountered or experienced as a doctor?
mm. Okay. Some of the things people ask, okay, fine, the prostate is big. Okay, you've told me to beware of prostate cancer. So how does prostate cancer come about? Is there stuff that I will eat? Or if I exercise every morning, will I reduce my chances of getting prostate cancer? Those kind of questions come up. And some people will even ask, is prostate cancer transmissible? Those questions do come up. But the thing, now that I talked about the benign or the non-cancerous growth, when it comes to the cancerous growth, it can be silent, it can take the same pattern, but in terms of risk factors, what are these risk factors that would cause you to be more likely to get prostate cancer? So there are about four that are broken down into small subjects, but I'll talk about them broadly. One is definitely gender. You have to be male. For
Okay.
you, the male means you have a prostate, and if you have a prostate, there's a likelihood of getting prostate cancer. Number two, family or family history, history of first degree relatives getting cancer. Maybe your father, your grandfather, your uncle, your brother, had prostate cancer at some point, diagnosed prostate cancer. Then there's an increased percentage of you likely getting prostate cancer.
Yeah.
There's also in familial, there's also something described as hereditary, where you'll find it's not even related just to the men in your family. Even the women who are
Yeah.
related to you in terms of mother, auntie, sister, have had some form of cancer. And one of the common cancers that we see even in this country is breast cancer. Why would breast cancer relate to prostate cancer? There is a correlation with some gene mutations. Like there's some BRC, there's some genes in breast cancer that
Yeah.
would directly relate. There's a gene called BRCA, and mutations of this would also seem likely to have an effect on the men who are in that family and the like, or the children, the male children in that family, to make them likely to get prostate cancer. The third main, uh, another big one is race. So it's been shown that people of African origin, yeah, or African ancestry, they seem to have a more likelihood of getting prostate cancer, prostate enlargement, and this is just based on genetics.
Okay.
And genetics are very different, even for us. Like if you see our skin color,
Yeah.
we are less likely to get the skin tumors and the skin malignancies just because of the pigmentation and the melanin, and that's genetic. Same thing applies to the prostate. It's been shown that African ancestry, yes, there's an increased chance of getting prostate cancer. Another one is age. The older a man gets, the more likely he is to get prostate cancer. So we start seeing peaks of anywhere between 60 and 80 years. You'll see a certain peak of prostate cancer issues or prostate issues. And that's why even when we're doing screening or we're asking men to have a checkup done, we start from the age of 40, 45 years, depending on some reasons as we evaluate the men. So
Okay.
those are the four commonest ones. There are other additional factors, but they don't seem to directly relate to prostate cancer, but they relate to any other cancer, smoking, metabolic syndrome, obesity, excessive alcohol intake. They don't directly relate to prostate cancer,
Yeah.
but there are studies that would show a relation. Not, I would not tell you that if you are obese, you get prostate cancer. No, that is not what I'm saying. I'm
Yeah.
saying there are other additional lifestyle factors that would make you more likely to get any other kind of cancer, not just prostate cancer. So
Okay.
those misconceptions about what are the risk factors, and
Yeah.
those are the four main ones that have a good evidence to them.
It's quite
Mm,
interesting that
mm,
genetic predisposition or family
mm,
history has a
yeah,
very huge impact.
mm,
Now, without sounding too medical,
mm,
in consideration that as we saw, I mean, all as the statistics show, when
mm,
it is discovered really early, more than 98% survival rate.
yeah,
And if, let's say, treatment has been successful,
mm,
and let's assume that I'm a gentleman, I have a son, maybe I have gotten prostate cancer
yeah,
later, but it was caught
mm,
early. What would or what should I be on the lookout for when it comes to my next of kin, my son, my grandson? What are those things that parents need to be aware of? It could be, say, my grandfather has had
mm,
it. Maybe my dad will not have it, but maybe my brother can,
mm,
because of that genetic
mm,
predisposition. What advice would you
mm,
give so that people, we ensure that we we continue having that great
mm,
success rate, but also that
mm,
awareness is not, or the discussion of it, it's not deemed as
mm,
taboo,
mm,
because, and I stand to be
mm,
corrected, men having, talk on their
mm,
health is not as common as you will find ladies
mm,
having, discussions on their health, the pap
mm,
smears. I mean, they have too many encounters with their
mm,
OBGYNs. It could be a normal healthcare check, it could be maternity, it can be,
mm,
you name it. The interactions with the doctors are very, they're quite
mm,
frequent. But when you compare that with the male
mm.
gender, it's a different
Very,
story
very, very
altogether.
different
So
story. I agree.
how can we change,
I've
how
seen
can we
that,
change the narrative?
and it is a factor of so many things. Health seeking behavior of women and men quite different, and it like I said, it's a factor of so many things that wouldn't even fit in this discussion. You'd see, take for an example as simple as in Africa, just the culture, you know, the culture taboo to talk about the genitalia, taboo to be examined in the genitalia. Those things will relate to health seeking behavior. And you'll see the trends in health seeking behavior tend to be better where there is more knowledge and the knowledge is accepted. That's why forums like this are very important, where people get to demystify what is this thing that cannot be talked about, what is this that is taboo. So culture is there.
Yeah.
Of course, the health seeking behavior will also be different based on what your exposure has been, how educated. Yeah. Do you know that there are organs in the body and these organs need to be checked? Same principle applies even to having a vehicle or a border or a bicycle. You'll take it for repair, you'll take it for service, you'll go have a checkup and make sure that all components are functioning well. Which ones are worn out, which ones can be replaced, which ones need attention. So the same thing I'd advise everyone who is listening to this, you become an ambassador of telling others, yes, the first thing you should do when you think there's a problem, get help, get information. And information not from Dr. Google, please. You'll you'll type in headache and it will tell you have cancer. So avoid that path as the first path. Yeah. Go to a qualified
Okay.
healthcare practitioner. Doesn't necessarily have to be the urologist first, but even you.
Yeah.
whichever healthcare provider is near you, go ask a question. Be curious.
Mhm.
Sometimes you don't even need to pay money to do that. Most majority of people have somebody around their community who is in the healthcare profession. Yeah. And those who don't have, there'll be a school nearby, a religious institution nearby, a church, a mosque, and you'll find these health camps are held and people are called in to come and have their checkups. These are forums to go ask a question out of curiosity. Do you have a problem? Am I okay? So when you do feel the sense of something might be going on, it will always be good to get more information where you don't have. And it applies to any other profession. If I needed to know something about media or hosting a forum like this, I think I would come and
Yeah.
ask you because I would be the least qualified person to host it.
Yeah.
So I think getting information and seeking information demystifies those taboos.
Now,
Mm,
when now let's talk about how can we start. So, what
mm,
tests need to be done, but
mm,
also normally, for example, when a child is born. So, let's say you have a
mm,
son as an example.
mm, mm,
The typical tests that are done on a baby
mm,
by the pediatrician, do they also
mm,
check the genitalia, maybe the formation of it, if the test,
mm,
I mean, the scrotum is,
mm,
if it has dropped or not, and such
mm,
things. And then what can we do to, as you've correctly mentioned,
mm,
having awareness sessions,
mm,
men, like a men's conference, how can
mm,
we build that and ensure that
mm,
people are embracing, the fullness of, well-being. So
mm,
from a medical perspective, what are those tests that
mm,
what tests are normally done? Are
mm,
they painful?
mm,
Are they uncomfortable? I
mm,
can speak from a lady's perspective. I would know what would
mm,
happen, but now for the
mm,
gentleman,
mm,
what do we need to be aware of, and what
mm,
actions should we
mm.
take?
So, a very, very good question, and actually started from the pediatric age group, which is important. We've seen conditions, urological conditions that are missed until the male is an adult. So these things should be checked right from birth, like you mentioned, the external genitalia, what you can see. The common things that we see missed out is an absent or an empty scrotum, whereby you find those testes that are supposed to be there are not there. We call it
Okay.
cryptorchidism. Some of them are still within the abdomen. It's a correctable condition. We actually correct
Okay.
it, bring them back to the testes for those we are able to, but that's the majority. So
Okay.
those are some of the things, even when a mother is washing the child or the father is taking care of the child, it would be good just to confirm both testes are there. Because if they're not, then they can result in other problems in future, fertility issues, hormonal issues in the future. Again, remember we mentioned about the conduit, the urethra.
Yeah.
We see abnormal openings of that urethra. It
Okay.
could be in an abnormal position. Remember, the function of that urethra is a conduit to carry both urine and later on in the man's life, also the ejaculate will be there. So, it being in an improper position might compromise those functions that it has. So, there's something called hypospadias, which is common in this country, whereby you find the opening is not at the normal place, and that's something you would see. And if you're not too sure, it would be good even for the pediatric age group. Be curious, go to the hospital, go to a healthcare provider, ask them, is this normal? Is this not normal? Those are, they're not necessarily tests, they are examinations, they are painless.
Yeah.
And this is something that would sort out so many issues for the man later on in life if they're discovered in the pediatric age group. Now, relating to the prostate, how do we get to assess the conditions that are there? The first thing we do is we talk to you. We ask a series of questions. It's a conversation because you're the one having the history. We don't know it. We are just going based on evidence based medicine. What we see, the trends that we see, 1 plus 1 is 2. Then, if we see this symptom and they're happening in a cluster, then likely we are relating that way. So we talk to you, we ask you a few questions, about your urinary system, your general health, the family history, whatever past medical history you've had, even your family and social history. And we finally do something called a systemic inquiry. We ask you, of all the medical systems that are within the body, there are symptoms that seem to pop out when something is going wrong. So once we've tabulated that history and we've focused it on what we might think we are dealing with, you get an impression of something. When you have that impression, now you go further and do an examination. And we start with the general exam, start with the general systems, find out how it is, because symptoms or conditions of the urinary system don't necessarily only present in the urinary system. They can affect the whole body.
Okay.
Yeah. You get a blocked urinary system, some substances go high in your body. You could even convulse. Like, I hope you're still able to hear me. Yeah.
Yes.
You
Yes.
see,
Sorry about that.
um, I was talking about how the urinary system can appear in another system. Yeah. Having
Yeah.
something as shut down kidneys can present on your skin. There's something we call uremic frost, edema. It's
Okay.
just fluid overload in your body. Some people even get a form of encephalitis. We call it uremic encephalitis just because there's an issue in a urinary system. The same thing would happen if your liver is there. So that's why we do the general exam. Then once we are done with that, we do a specific exam. Now, the specific exam involves, of course, examining the external genitalia, examining the abdomen, and the one most men hate the most. We call it a digital rectal examination. I'll use this, um, I'll put this into frame again just to try and explain why it happens. It is,
Okay.
as much as it's not comfortable for the patient, it's not necessarily comfortable for the doctor. Yeah. It, especially within the African cultural environment, many men run away from having prostate examinations, prostate assessment, thinking that this is the only examination that can be done because of the prostate. I want us to go back to this image, and we remember where the bladder is, we remember where that urethra
Yes.
is going out, and we remember where that
Yeah.
prostate is. Now, if
Prostrate.
you look
Yeah.
behind the prostate, that is where the rectum is. Okay, and this is where
Okay.
somebody
Yep.
goes to for a long haul. Okay, this is where the stool
Yep.
is stored before it is eventually evacuated. The reason why medical professionals would do a prostate exam is because of that proximity. It is the closest surface on the body where you can be able to examine the prostate. It is not the only way to examine the prostate in terms of getting to find out, is there a problem with it? No, there are other ways.
Okay.
So this is not a mandatory examination. No, it gives us some information, but it doesn't give us all the information. And that's the one many men run away from. So among other tests, we have blood tests that are done. And blood
Yep.
tests, there are some, I'm sure, a very common one is called a PSA, a prostate specific antigen test. There are a series of other tests based just on that, on the PSA alone, that could tell us a story of what's happening within the prostate. So doesn't necessarily mean that, okay, your prostate, your PSA is normal, so there's no likelihood of cancer, or the PSA is high, so they need cancer. There are other factors that could also cause the PSA to increase. So that assessment is in totality. It is not isolation of one marker or this or this. It is a whole story. It's a whole journey. That's what you put together to finally get to the diagnosis. There are imaging tests that are done, from the basic ultrasound that could very well give you a picture of the prostate, give its dimensions, show its size. Is it blocking? Is the urine being left behind? Is it able to pass? It would give you a lot of information on that. Beyond that, you could also have an MRI done that would tell you a whole other story, to add a lot more information, to even point out here there's a
Yep.
likelihood of cancer. There are scoring systems that even tell us, okay, now here you need to biopsy, or here you don't need to biopsy. So, among other series of tests, and we don't do all of them at a go. Like we say, what is
Yeah.
likelihood of the benign we'll assess. Once we assess and we see, okay, fine, this is not just benign, it is enlarged, yes, but likely cancerous. So we go a step beyond. So it's not walking to the
Okay.
urologist's office and they put down, go do an MRI so that we can assess your prostate. No, story. We start by the history, we do the examination, we do a collection of some tests. Once we're done with the tests, now we cluster them all together and say that, okay, fine, your prostate is enlarged. Fine, there's likelihood of prostate cancer. What can we do from that point? Is it treatable? How would we sort it out beyond that point? So this information is to make men feel comfortable. Come, you don't have to have a prostate exam done. It is not mandatory. It is beneficial for some information it can give, but it is not the whole story. Yes. Mm,
Okay. Make, that makes a lot of sense,
mm,
and it's encouraging to know that it doesn't have to feel as
yes.
intrusive. The fact that there are blood tests that can
Mm,
be done, which now brings me to an aspect. Two things come to
mm,
mind. One, what are the signs of and symptoms of an ailing
mm,
prostate? And for example, maybe someone, as the statistics
mm,
show, African men are, the risk factor is
mm,
insurmountable. So in this case, if maybe someone has not had, the medical checkups and they really do not
mm,
know the state of health when it comes to prostate, what do we need to be aware
mm,
of as signs and symptoms? Maybe we have a loved one, maybe a grandfather or an elderly dad, etc., that might be having prostate
mm.
issues that we are not aware of. But what are those symptoms that we need to you know top of
Okay.
mind when you see your loved one is
Mm.
experiencing that? Then you're like, hold up, maybe
Okay.
you need to go see a
Okay.
doctor. And
Okay.
yeah,
Good
what do we
question.
need to
Good
be
question,
aware
Rosen.
of?
So I always put it as basic as possible. Start with the senses that you have. Start with what you can see. That means whenever you go to pee, look at your urine. What color is it? Is it cloudy?
Okay.
Does it look like it has blood in it? I mean, that's the first direct sense that will tell you, okay, there might be an issue. What amount is coming out? Is it dribbling? This is something the man can see on himself that there's an issue just by what he sees. And again, beyond that, even smelling, the color of the smell of the urine will tell you, okay, now normal urine doesn't smell that way. Or for me, it has not been like that my entire life. Or is it changing the order at this point in time? So the basic senses would give you a lot of information to tell you, okay, fine, there might be a problem. What do you feel? And some of those, you remember the IPSS scoring system I was telling you? Some of them are just based
Yeah.
on the common senses that we were created with, What do you feel? Do you feel a sensation of urine being left inside? Are you waking up many more times than you used to at night? You can't even have adequate sleep. You're tired during the whole day, or you have to keep on going out of meetings with your phone, pretending you're on a conversation because you need
Yeah.
to visit the loo. Men do those things, and the urine that is coming out, is it less? Is it dribbling? Does it have the pressure that it used to have? So what you feel can give you an indication of what is going on. Now, the silent bit is the one that we worry about, and that's where we create awareness. Prostate cancer is majority silent, same as hypertension. You don't know there's a problem until the day you get a stroke, so these are things you do a check on once. I usually tell men at least do a yearly, at minimum, do a yearly checkup. Go see somebody once a year
Yeah.
and ask this question. So these checkups help us to see those silent markers, especially of prostate cancer, because like the prostate cancer that we see in this country, most of it we get it at a higher stage where we are not able to give a cure, but we're able to do something called palliation, whereby you help somebody live with that cancer. but majority of that would have
Yeah.
been avoided if there was a series of checks and tests done when the man was just feeling normal, when he was not having any issues with his urinary system. And yet at that point, the prostate cancer cells were just silently migrating somewhere else without symptoms. So that is why we encourage checkups. It doesn't mean we want to be paid consultation. No, it is for the good of your health. The same way a manufacturer would tell you, if you use the vehicle, if you
Yeah.
use this item, it's good to do some service on it. You need to
Yeah.
go do some checks on it. Same thing with the human body. You need to make sure everything at a specific age is normal. So I'd go by basic senses: what you see, what you smell, what you feel as a man. Sometimes it will be recognized by the spouse. She'll notice that, oh, he's waking up many more times at night. Why? Or he's leaving meetings many more times. Or we are going for a journey from here to whatever part of this country or anywhere else, and he's always stopping at a hotel to take a loo, to go and pee, or a petrol station to go and pee 4 or 5 times. That
Yeah.
tells a story. Some of these things are pointed out by the people, the dependents, the spouses around the man. But some of them, the man himself can know, but just by the basic senses. Yeah, that's what
Okay.
I would
Now,
recommend.
as you know, as a consultant urologist, I believe you have encountered patients that have come to you very frustrated because say they have sought medical
Mm.
advice, but the people that they interacted with did not help the situation. They were taken round in circles. Maybe they were not fully understanding, or you know, even if you get the test done, the explanation is not there. How can how can we break that bias? Because yes, I do not expect a clinical officer or an intern doctor to be fully aware of the specialty.
Mm.
However, how can we also ensure that the medical fraternity is also supportive of you know abiding to best practice, and also putting two and two together? As you said, sometimes it's not necessarily the prostate, it can be a UTI, urinary tract infection, but also having that conversation of, in as much as maybe the patient has UTI, what do they also need to be aware of, considering it's the bladder and then the prostate is immediately after. So such conversations, what is your commentary on that?
That's a very loaded question. It touches on policy, touches on healthcare delivery systems, which I don't want to comment to right now. Environment, but I'll
Hmm.
say something. Like, I give you an example. Uh, in our country, Kenya, we have approximately
Yeah.
between 60, 70 urologists. These are registered urologists by the council that are fully practicing as consultant urologists. There are others coming up in training, and there's a training program in the university that is training future urologists. So they are there, but they are few. You look at
Yeah.
60 for a population of about over 57 million. I mean, that's a tall order. So
Yeah.
starting by these forums like this, the people who get to hear, oh, there is a urologist, and I don't work alone. I work in an association. There's Kenya Association of Urological Surgeons. Those are the main ones that provide the expertise, the advice on healthcare relating to urological conditions, both in the male and the female.
Yeah.
So that is a starting point. But this is an
Yeah.
encouragement to anyone who seeks out information about the urinary system or the prostate. The medical training systems within the country are quite good enough, up to the basic, I'll say, the clinician, yeah, the service workers, they may not have the full information. But they know where the referral system works. You'd see somebody, maybe you see a nurse, and they tell you, okay, now you need to go and see a cardiologist. You need to go and see uh, a urologist, or you need to go and see the medical officer. You get to the medical officer, they tell you, okay, fine. You need to go and see the pediatric urologist. You need to go and see the adult urologist. So the
Yeah.
referral system is in such a way that everybody in that chain of the healthcare system is able to redirect, even if they don't have the full information. So it's an encouragement even to the audience for those listening. They still help even at the most basic level.
That's very encouraging to hear. And the more we bring, or we, yeah, the more we bring the awareness to the population, hopefully, the the instances of stage 3, stage 4 inoperable cancers will diminish, and we will be
Mm,
dealing with, the 98 plus percent of survival rate. Now,
yeah,
let's talk fertility, prostate fertility, and the whole 9 yards.
yeah.
How, I bet someone might ask, okay, so prostate health and fertility, how do the two marry? And what, how how can we ensure that fertility is not impaired, but also aspects to do, you mentioned aspects to do with ED, erection, erectile dysfunction. So good that you could kindly comment on that.
Okay, comments. They are not directly, I'd say, related.
Mm-hmm.
You mentioned two things. You mentioned about erectile dysfunction. That
Yeah.
is another big chapter that involves the whole body system and the various systems that are involved.
Mm-hmm.
Doesn't directly relate to the prostate, but it
Okay.
can be one of the factors that could point out, okay, there's something here. Same as fertility.
Okay.
Fertility may not directly be related to the prostate, meaning that if you have an enlarged prostate, you're not fertile, or if your prostate, you have prostate cancer, you're not fertile. The big part of fertility factors as relating to the prostate come when the prostate is being managed.
Okay.
For where the prostate is, and a factor of its function is when ejaculation is happening, sperms go forward.
Yeah.
When you do a sort of surgery that we do to correct the enlargement of the prostate, we remove that blockage of sperms being propelled forward, and some of them can go back into the bladder. Not meaning that you're not fertile. It's a very medical. I wish I could explain it as at the most basic level, but
Yeah.
to give a summary of it is part of the management of prostate issues, both benign and cancer, can affect fertility in a way, not 100%, but they can affect fertility.
Okay, so which then it then makes this conversation more valid and more. I mean, the importance of it in the sense of the healthier your prostate, the lower the risk in terms of the need for surgical interventions or medical interventions that can affect aspects to do with fertility, and directly or indirectly, because even if, as an example, if someone is chronically sick or is undergoing some intense medical treatment for whatever reason, even medication can have an impact of how your body is going to
Absolutely.
operate. So
Absolutely.
looking at health on a 360 perspective, and for the men, it's an aspect of their manhood, their pride,
Mm,
their ego. All
mm,
of this needs to be looked into, not only
mm,
from the physique aspect of it, but also now what a lot of us would not see. The
mm,
prostrate, the testis, the urethra. The blockages that come about. The someone is not peeing fully, so you still feel that
mm,
you have pee within your bladder, and I bet it will also have irritabilities that come with it. Now,
mm,
what advice would you provide or would you give caretakers and family members that are handling, people or patients that are undergoing treatment to do with prostate? So it can be the cancer or maybe a minor intervention that has taken place to
mm,
correct a blockage or whatever it is. What advice would you give caretakers and, yeah, family and friends that have people that are having those
mm.
issues?
Yeah. like I mentioned earlier on, when we are treating the prostate, we don't focus on the prostate, we focus on the man. He just may be happening to have a prostate that we are treating. So when we are treating him, even the series of questions that we ask, even the family history that we ask, we know that there is an environment around him that may be relating to his spouse, his dependents, his parents, anyone who is around him. So when
Yeah.
we are treating the prostate, directly we are treating the man, and we are treating how we treat him is going to affect his environment. What my advice to people around, whoever is being treated, would be basic compassion. Compassion doesn't need medical knowledge, just needs to know that something is going on. And even if you don't fully understand it, and you may ask and not be given answers, but just that compassion, that would be good enough. Just help this person along the way, even if
Yeah.
you may not be having the full medical picture. So
Yeah.
that plays along well, especially with encouraging men to have that health-seeking behavior. Yes,
So compassion, promotion of the health-seeking behavior, and less reliance to Dr. Google, because
absolutely.
it can bring in misconceptions about the treatment at hand. Now,
Mm,
as we come to a close, when it comes to the ladies, there's advancement in terms of vaccines. So, for
mm,
example, cervical cancer, there's the HPV. Hope I got that right. Vaccine.
mm,
What advancements have been taken on, say, the men or the male health? You know, so when it comes to prostate cancer, are there any statistics or scientific studies that are currently taking place that, for example, if I have my family has a history of prostate cancer, that means I'm
mm,
also, in as much as I'm a lady, I have that genetic predisposition that I can pass it
mm,
on to my daughter or my son.
mm,
How can we, or are there any, or is there a likelihood that maybe in future there will be a vaccine that will be provided, to our brothers, our sons, our nephews, that can, it does not mean that the person cannot get it, but even if they do, the risk factor is greatly reduced, and the survival rate is greatly increased. Any thoughts on that?
mm. Well, I'd say for now, there are a lot of genetic studies that are happening in prostate cancer. It's not fully understood. Yeah, the scientists are still trying to understand why does it behave this way in a different race and behaves this way in another race. It behaves this way in a different environment with a
Yeah.
different feeding habits, different age, different subset group of men. So there's a lot of genetic studies, comments about vaccines, not currently nothing out that somebody would say, give this to the boy and in future you'll not get prostate cancer. Unfortunately,
Yeah.
that is not the case. But there's usually hope. I mean, there is a day we didn't have internet. Now we can talk directly and have
Yeah.
these forums. So there's always hope. There's always hope.
Thank you so much, Dr. As we come to the tail end of this men's special edition in terms of understanding prostate health, what's your parting shot to the people that are watching us live, or those that are going to view this schedule? I mean, this session. What's your parting shot?
My parting shot is avoid procrastinating.
Okay.
It's simple. If you've ever had the thought of what is going on in my body as a man,
Yeah.
and you say, it's okay, I'll go next week, I'll ask this question. A year passes, 2 years, 10 years pass.
Yeah.
And and men have those thoughts. Men have those. One day they open the phone and they go to Google and they're like, oh no, this is relating to me. Check it out. They keep it to themselves. They don't mention it to anyone. Party shot is don't procrastinate. Go
Okay.
have that check. As simple as it may be, talk to a healthcare provider. Go ask that question. Be curious enough to ask that question. don't procrastinate. That's my parting shot.
Well, I couldn't agree more. I think it doesn't help that culturally, a lot of, the African setup, men are raised to be strong. Men don't cry, men are not expressive. And therefore, I think we have also, and as in, we have been the reason why men are not expressive, men are not, I'm not saying they're not keen, but when you compare that with the ladies, we beat them by a mile or very many
Mm.
miles, so to speak. And I think we need to change, that that notion that a man expressing himself, going to see the doctor, it's not a sign of weakness, but it's an enabler for him to be aware of his health, to be there for his family. And by knowledge is power. So by the fact that someone is more aware, then maybe then they can observe how you go out and party. Maybe you will indulge in the alcohol, but did you hydrate? You will become, maybe this is something you can comment on, you know people that have multiple sexual partners, what do they need to be aware of? Also, people that, the sexual predisposition, we have, our brothers that are, gay in this respect. What do they need to be aware of when it comes to matters of their health? And how can we ensure that we are bringing up a generation of fully aware men that are not afraid to express themselves and are not afraid to take that next level of ensuring that their health is key? Terry?
My advice is always, if you're a man and you're aging, by men here I mean by gender, you have the
Yep.
XY chromosomes, it's genetic,
Yep.
and you're aging, it's always good to have information about your health.
Mhm.
And one of the biggest things we see with the aging male is prostate issues.
Mhm.
So if you're in that bracket, it's always good to be curious. Don't procrastinate. Go to a healthcare provider. Go to a urologist. Go to a nurse. Go to a medical officer. Ask. Ask a curious question. When you hear there's a health camp happening somewhere, you don't necessarily need to have all the invasive things done, but it starts with a conversation. So I'd encourage that health seeking behavior. Don't procrastinate.
Fantastic.
Mm.
Daktari, I cannot thank you enough for your time. Thank you very much for this enlightening session. I totally agree. I think we need to have more and more forums where we are, building awareness, particularly to do with the male health. Yeah, I don't think enough has been done in that respect, and I
Mm.
think we need to break the barriers and understand that it's not taboo to have conversations with a doctor. I can understand maybe someone might not be willing to have a physical assessment, because maybe the urologist is male or whatever gender the doctor might be. But in
Mm.
consideration that there are many different types of testing and ensuring that someone is more aware of their state of health, I think we need to embrace that. Maybe we also need to have these conversations in high school platforms so that the young generation is also aware that as they go out there, this is what they need to look out for, this is what they need to be aware of, because they have fathers, uncles, grandfathers, the whole, the whole family setup is there. Thank you so very much for this session. Unless you have any
Mm.
other insights you would like to share, I think we can bring a close to this insightful session of,
Thank
Unplugged
you,
with Rose.
Roslyn. It's just to thank you for hosting me.
Yeah.
And it's good to get this information out there. So keep on. And thank you for hosting me.
Thank you so much, Daktari. Everyone that has joined us, I thank you very much for your time. In case you have any questions post this session, feel free to reach out to me on my LinkedIn profile or if you know me personally, feel free to get in touch. And if you want me to put you through to Dr. Kagiri, I would be more than happy to to share that. As a HR professional, in the workplace environments, we have colleagues that, if you want to have health talks with your employees, that can be arranged separately. So I thank you for those that have sent feedback. Daktari, there is a lot of positive vibes coming your way over the insightful session. Thank you to those that joined us through LinkedIn. Thank you to those that have joined us through YouTube. I can't thank you enough, and I do wish you all a lovely evening. Daktari, have a good one, and good night, everyone. Bye.
Thank you. Thank you. Good night.